A common question that we get is how safe are the vaccines? How many people have died, or what side effects have we seen from the vaccines? This comes from multiple resources. The original vaccines published their trial data, which is openly available on the FDA website, and were mandated to report all the side effects that they found. Some did die in the control group, and some died in the treatment group. That means some died who got the vaccine, and some died who didn't get the vaccine, and there was no difference between the groups. And so that's how we know the vaccine doesn't cause death. Since the emergency authorization of the vaccines early on, there has continued to be tracking of all side effects and all deaths that we even think might be related to the vaccine. In fact, it's mandatory to report these. And the CDC collates all this information from multiple sources. Some of you may have heard of the Vaccine Adverse Event Reporting System, or the VAERS database. This is a public database. You can go look at it today by going to the CDC website and searching for VAERS, or VAERS. But there are a couple of stipulations for what you're going to see. Recall, it is important and mandated that physicians and organizations report even possible deaths or possible adverse side effects from vaccines to the CDC. And this is the database for how we do so. Then it's the responsibility of the CDC to go back and investigate all of these claims. In the database, they're just claims. They're just possible relations. So you can't look at the database and say, oh my goodness, there have been 2,000 deaths from this vaccine. Some of those are unfounded. Some of them are people who have been vaccinated but died from other causes that are coincidentally related. And some of them are real. But until they get fully investigated, what we know is what's been published. And what's been published is that there are some known side effects from the vaccine, but they're extremely rare.